There's no problem. I think again there are, to be like real or logistically real here, some cases by the time they get referred, if it's gonna be like a period more that is not safe for the patient to wait, then I'd rather the patient starts the steroids for safety, because some cases cannot wait. Just the general condition of the patient will deteriorate if they are not started on steroids. So if it is urgent, then absolutely it should be started. Now, if the patient's symptoms are chronic and they have been going on for a long time and we're not sure, then in this case, maybe we can do the referral first so we can do the testing. Also, it does, I think, even if our primary doctors would like to proceed with the confirmation, like ordering the ACTH stimulation test, this also helps. However, I do not recommend, so if the patient already got steroids, then we cannot check them right away, because it depends on how long they have been on the steroids. For example, hydrocortisone, we have to stop it for like 12 to 24 hours, so we can, whenever we are checking the cortisol level in our body, so it doesn't basically cross react. If a patient took hydrocortisone and I check their cortisol level, I am not really checking what their body produced. I am checking the medicine that they got. So it's not going to be beneficial to diagnose. So I'm gonna, what we can do is that if it is safe, we ask them to hold that hydrocortisone for possibly 24 hours if they can, to make sure that it's completely out. Or if it is prednisone, like other types of steroids, they have to be held for longer time. So prednisone, possibly 48 hours, dexamethasone, if possible, even 72 hours, though the dexamethasone level itself does not cross-react with the cortisol level. However, any steroid will cause suppression of the ACTH, which is coming from the pituitary gland. So basically, we cannot do testing for adrenal insufficiency if the patient is on the steroids. However, if the patient was diagnosed by his primary doctor, he can and at least just draw the ACTH if possible before you start him, and then after this they can start and then they can get referred to us.